All right, hey everyone, it's Drew here at ASAP 2017 in San Diego at the IM3 booth, joined by Dr. Michael Lee from Park Cities, Texas. How are you?
It's great to be here, Drew. I'm doing very well.
Good. Tell me about the show so far. You having a good time?
Yeah, this meeting is always a very enjoyable experience. I think ASAPS is always at the forefront of all things plastic surgery, so not just the science, but also the business aspect of what we do and non-surgical modalities. It's a very progressive society, so it always makes for a wonderful time.
Cool. Tell me a little bit about some of the sessions that you attended. Anything you're looking forward to bringing back to your patients?
Well, in terms of this particular meeting, so I'm on several committees, and one of those committees requires me to go to a lot of the surgical lectures and so forth, and then I sort of grade those. And so it's, for me, the vast majority of this meeting has focused on science and medicine, not so much the business aspect. But obviously with everything that you go to from an academic standpoint, there are pearls that you can bring back to your surgical practice. So, yeah.
Awesome. So we're here at the 50th anniversary of this show. So talk to me a little bit about the evolution of aesthetic plastic surgery, I guess, in the last 10 years, and where do you think you see this going in another 10 years?
Well, this society was born out of a necessity to focus on aesthetics. We already had sort of societies for other components of plastic surgery. So there were societies for pediatric craniofacial surgery or hand surgery, but this was born because there wasn't a real focus on aesthetics, and that's what makes this so special. Ironically, this society was started with thoughts written on a napkin at Harry's Bar in Venice, Italy, which I was actually at about 3 or 4 weeks ago, so it was really neat.
No kidding.
Just for all this to come together at the same time. But yeah, over that 50 years, there's been a huge evolution of just surgical technique in regards to all different areas of aesthetic surgery, but also in setting guidelines, patient safety, business practices, all based off of educating aesthetic plastic surgeons to where ultimately patients are prioritized and get the best care.
Cool. Good stuff. All right, let me jump into some just rapid fire fun questions I'm going to ask you, okay?
Oh, I thought that was the rapid question. Okay.
What's your favorite color?
Blue, man. It's the color of the sky.
Favorite sport?
I would have said football, but as of late, maybe baseball.
Okay. Favorite baseball team?
It's got to be the Rangers, man. I live in Dallas.
You have any children?
2 children, 9 and 11.
Which one's your favorite? Just don't answer that. Just kidding. I'm trying to get you in trouble.
Yeah, and that would do it.
What was the last thing you watched on TV?
Oh gosh, surgical videos on the airplane ride here.
Okay.
Yeah, so I'm pretty much a nerd.
Awesome. Any advice you would give to a previous boss?
To a previous boss, let me think about that. Advice I would give to them: to treat people fairly and kindly. I think I love the team aspect of a work environment. I think that's a really progressive way of thinking, and but I think when that is accomplished, it optimizes your efficiency. People that want to work to achieve the same goal, everybody operating at their highest capacity. So,
why did you get into plastic surgery?
I think plastic surgery chose me. From as far back in my life as I remember, which is 5 years of age, I've always been obsessed with being the best, and that has permeated my life. And plastic surgery, I was also really artsy. When I was in high school, I drew, I painted, I did some stuff for actual commercial reimbursement. So I was always very artistic and very meticulous, and people have throughout my whole life said, someday that's going to slow down. And as I approach 40, I find that I'm actually just getting started. So plastic surgery works well with that personality.
My next question was going to be, what were you like in high school? But
yeah, I was super cool. I mean, everybody wanted to hang out with me, and just as you would imagine, right?
Of course, yeah.
I don't remember throwing the winning touchdown in the state championship game, but it was probably because I was just everybody was hoisting me on their shoulders, and it's hard to remember that stuff.
Awesome. Any unique talents outside of plastic surgery and art?
Outside of plastic surgery and art, well, I can hang a mean 95 on a golf course.
Really?
So, yeah, I'm Captain Bogey is my nickname.
Okay.
And I think that's a real skill set.
It's better than me on the golf course.
That and a bow staff. Yeah. So, yeah.
Nice. What's your biggest fear?
Oh my gosh, living a life that I would look back on and feel that I was focused on myself and not others.
Beautiful. What do you love most about your job?
Changing people's lives for the better. It's
okay. Sorry, go ahead.
It's the feeling when you wake up every morning and you know that there's going to be a positive result because of what you do. Not everybody gets that, so it's a wonderful part of plastic surgery.
Great. Last question. If an owl walks into this room wearing a sombrero, what does he say?
Cash me outside.
Best answer of anybody so far. Awesome. Thanks, Dr. Lee. Appreciate you joining us. Have a good show.